Hello students, this is your presentation of chapter 4.4. In the last presentation, I have discussed factors underlying abnormal behavior, and in this presentation, I will be covering classification of psychological disorders and moving on to major psychological disorders where I will cover anxiety disorders, obsessive compulsive and related disorders, and then trauma and stressor related disorders. Classification of psychological disorders. Now, in order to understand psychological disorders, we need to begin by classifying them. A classification of such disorders consists of a list of categories of specific psychological disorders which are grouped into various classes on the basis of some shared characteristics. So, the psychological disorders, some of them, they share certain characteristics which are similar, and in order to differentiate them from the other disorders, they need certain manuals to follow, and that's the reason why classifications are been done. So classifications are useful because they enable users. And who are the users? Users like psychologists, psychiatrists, and social workers. They are a team of workers, team of professionals who work together. They sit together, they discuss, they communicate with each other, and they discuss about the disorder, the psychological disorder they discuss, and they try to help. And the classifications, it help in understanding. It helps them to understand the causes of psychological disorders and the processes which are involved in their development and maintenance. So far, we have seen the history of psychological disorders, yes, how it evolved, and so far in which place it is. So, classifications, it helps the team of workers to, team of professionals to work on it and also understand it. So, there are certain manuals which are prepared and published by different associations, and such classification very common. There are two classifications worldwide it is used, but the first one, it is known as DSM in short. So this DSM, it was published by the American Psychiatric Association, that is APA, and they have published this as an official manual which describe and classify various kinds of psychological disorders. So the current version of it, the Diagnostic and Statistical Manual of Mental Disorders, it is the fifth edition that is in the current scenario. Okay, there are certain uh, versions of DSM. If you go and check in your internet, you will see that this DSM, the axis, there are 5 axes, okay, that evaluates the patient on 5 axes. So with time, this axis from DSM, the first version, till the current version, there has been many changes. Earlier, something might have been, uh, related with neurological things, neurological disorder, that has been shifted to psychotic. Some psychotic has been shifted to neurotic. So these are the changes. Slight changes are been made in the additions over there. So in order to classify and in order to understand the disorders, there is the preparation of this manual. So what the DSM does is that it evaluates the patient on 5 axes, or we can say dimensions, rather than just one broad aspect of mental disorder. There are 5 dimensions, and these dimensions, it relate to biological, psychological, social, and other aspects. Okay, so this 5 axis under DSM, it tells that what is the cause of the particular behavior. It might be because of biological factor, it might be for psychological factor or social factor. So this all falls under DSM, and the American Psychiatric Association, they follow DSM. Now what about India? If we come over India, does India also follow DSM? No. But in India, what they follow is that Indians, they follow ICD. ICD, the full form is International Classification of Diseases. In short, it is known as ICD, and at current scenario, it is in the 10th version. So the classification scheme, which is officially used in India and elsewhere right now, in the current scenario is the 10th revision of the International Classification of Diseases, that is ICD-10, which is also known as the ICD-10 Classification of Behavioral and Mental Disorders. And this ICD was prepared by the World Health Organization, WHO. Now in ICD, for each disorder, a description of the main clinical feature or symptoms and of other associated features, including diagnostic guidelines, is provided in this scheme. Okay, so these are the two classifications. One is DSM and one is ICD. In order to understand the psychological disorders, its causes, its underlying factors, and also the processes which involved in the development and maintenance. Now let us see some of the major psychological disorders and the types of disorders, starting with anxiety disorders. In your book, there is an example in order to understand anxiety. Now imagine one day while driving home, there's a boy named Dave who felt his heart beating rapidly. He started sweating profusely and even fell short of breath. He was so scared that he stopped the car and stepped out. In the next few months, these attacks increased and now he was hesitant to drive for fear of being caught in traffic during an attack. Dave started feeling that he had gone crazy and would die. Soon he remained indoors and refused to move out of the house. We can see how debilitating it was for Dave to, even carry his day-to-day activities after this incident. He he soon preferred to stay indoors, that is, he was not ready to go out. Now, so we all experience anxiety in one way or the other in some situations, yes? When you're waiting to take an examination, or when you are out there to visit a dentist, or even to give a solo performance, maybe we might experience anxiety, and this is normal and expected, and even it sometimes motivates us to do our task well. Yes, so when it is and why it is regarded as anxiety disorder? When high levels of anxiety that are distressing and interfere with effective functioning, that indicate the presence of an anxiety disorder. Okay, and this anxiety disorder, it is one of the most common category of psychological disorders. Now everyone has worries and fears. So what is the term anxiety regarded as? So the term anxiety is usually defined as a diffuse, vague, very unpleasant feeling of fear and apprehension. It's a negative feeling of fear, there is worry, and it is very vague. All right, and symptoms, the anxious individual, they have certain combinations of these symptoms. There is rapid heart rate, shortness of breath, diarrhea, loss of appetite, fainting, dizziness, sweating, sleeplessness, frequent urination, and tremors. Now, there are many types of anxiety disorders. The first one, it is generalized anxiety disorder. Now, the generalized anxiety disorder consists of prolonged, vague, unexplained, and intense fears that are not attached to any particular object. Unexplained, the person is fearing, the person is worried, but the person cannot explain the reason. Okay, so that's why it is said as it is not attached to any particular object or person. That is just, it is just vague. It is not attached to any object or any person, but there is fear, and we don't know why there is fear. The person doesn't know, can't explain why there is fear, why the person is worrying. So in generalized anxiety disorder, the symptoms that include are worry. There is always worry and apprehensive feeling about future. Some kind of worry is there about future, and the person is hyper vigilance that involves constantly scanning the environment for dangers, and it is marked by motor tension, as a result of which the person is unable to relax. So the person is restless and visibly shaky and tense. Now this generalized anxiety disorder, suppose the there is a woman who is a housewife, okay, and she have a family. She have a child who goes to school, and her husband goes out to work. So early morning she does everything. She has just made breakfast. She just ready the child to go to school, and she just did everything. So when it was time, her child went to school, her husband went to office, and later she was alone in the room, in the house, and she was doing her work. Everything is okay, everything is done very nicely. She has done everything, whatever rest of the works is left for her to complete. She have completed everything. And now the returning time, it is 3 o'clock, and the child doesn't return home. So what will happen at that time? She will start worrying. So 3 o'clock has passed, the child is nowhere to be seen. It is 3:05, the child is not to be seen. It's 3:10, still there is no sign of her child to be seen. Okay, her child did not come home. So here, gradually, then what happens? Her tension is building up. She's worrying now. So she's worrying regarding what? She's worrying for all the bad things. She's worrying that maybe something might have happened to her child, and on the other hand, her husband is also not at home. What she will do at that time? So gradually the tension is building up inside. Ultimately, there's this generalized anxiety disorder forming up. This is generalized anxiety disorder. Maybe the child is not coming home at that time. Maybe because on the way the bus might have got out of service. Maybe it might happen that the bus got punctured. It might happen. Why every time you're thinking for something bad? So the moment you're thinking something bad, and there is always apprehensive feeling, the woman, the lady is getting hyper vigilance over there, isn't it? And she's constantly scanning the environment for dangers. That is generalized anxiety. Okay. Another type of disorder, anxiety disorder, is panic disorder. Now, this consists of recurrent anxiety attacks in which the person experiences intense terror. So, a panic attack denotes an abrupt surge of intense anxiety rising to a peak when thoughts of a particular stimuli are present. So, such thoughts occur in an unpredictable manner, and the clinical features include shortness of breath, dizziness, trembling, palpitations, choking, nausea, chest pain or discomfort, and fear of going crazy, losing control, or dying. This is some of the symptoms of panic disorder. Next, we have separation anxiety disorder, which is also known as SAD in short, that is SAD. So, this is another type of anxiety disorder. Individuals with separation anxiety disorder are fearful and anxious about separation from attachment figures to an extent that is developmentally not appropriate. And oftentimes we see this separation anxiety disorder in children. Children with SOD may have difficulty being in a room by themselves, going to school alone, or fearful of entering new situations. And often we see that they cling to and shadow their parents' every move. To avoid separation, children with SOD may fuss, scream, throw severe tantrums, or make suicidal gestures as well. Even sometimes, uh, even in a very early age, young age, when children are told that you will be kept in a boarding school, you have to go and stay over there all alone. At that time also with SOD, the children, they they have difficulty coping up in that new environment, and they cry, they scream that no, we will not go. And often we see that children, not all, but most of the children, they just cling to their parents and they shadow their parents every move. Wherever the parents will be going, the child will also follow them. Okay, so the most prominent symptom of SAD, that is separation anxiety disorder, is excessive anxiety or even panic experienced by children at separation from attachment figures like that of their parents or anyone who takes care of their caretaker. So those are the attachment figures, and to an extent that is developmentally not appropriate. Okay, here in the diagram you can see some of the symptoms of separation anxiety disorder in children. There is panic attacks, tantrums when separating from parents or caregivers, fear of being alone, fear of sleeping alone or sleeping away from home, nightmares related to separation, fear of going to school, stomach aches, headaches, muscle aches before separation and at the prospect of separation, excessive concerns about personal safety, excessive clinginess while at home, and bedwetting. So those are some of the symptoms of SAD. Next, we have phobias. Now, I'm pretty sure that you might have met or heard of someone who was afraid to travel in a lift or climb to the 10th floor of a building or refused to enter a room if she or he saw a lizard. You may have also felt it yourself or seen a friend unable to speak a word of a well memorized and rehearsed speech before an audience, isn't it? So, these kinds of fears are termed as phobias. So people who have phobias have irrational fears related to specific objects, people, or situations. And phobia often develops gradually and starts with a general anxiety disorder. For example, people scared to climb heights, afraid of deep waters in an elevator, as I said already. So, in general, the phobias can be grouped into three main types. Okay, that is specific phobia, social phobia, and agoraphobia. Specific phobias are the most commonly occurring type of phobia, and this group includes irrational fears such as intense fear of a certain type of animal or of being in an enclosed space. Okay, so specific phobias, it has certain triggering point. Triggers, that is when you see, hear or think about feared object or situation. Suppose a person is feared of a spider, you know, the moment he or she sees a spider or hears about spider or even think about spider, it just triggers. Okay, and this event induces thoughts about even, that is the thoughts. So that is something bad is going to happen, I will not be able to cope, I'm going to be harmed. These are the thoughts that is processing. Okay, the moment he or she thinks about the object of that feared object, then with the thoughts induce anxiety, and that anxiety might come under the feelings. With thoughts, once there is this thoughts coming in the mind, there is this feelings develop, that is anxiety, fear, physical effects of adrenaline response, the fight or flight response occurs, and anxiety makes one avoid it, and that is what is seen in the behavior, that is avoid feared object or situation or flee or escape. So avoidance maintains the belief in the danger and tiredness of events. Okay, and this ultimately again this cycle it repeats again and again with a specific phobia. The moment they think there is this feelings and it is shown in the behavior, that means they will flee from the situation or they will not face the situation. Okay, next we have social anxiety disorder, also known as social phobia. That is an intense and incapacitating fear and embarrassment when dealing with other characters. Many times we see that people are afraid to, talk with people and forget about addressing the audiences, the crowd, where the person have to go on a stage and then address some meeting or any kind of event, the person will not be able to. That is social anxiety disorder. That is social phobia. Even to, handshake at the other person, they have intense fear, and they also have, every time they have certain kind of embarrassment. That's of course again another irrational fear. It's not rational. And lastly, we have agoraphobia. Now, agoraphobia is when people develop a fear of entering unfamiliar situations or sometimes afraid of entering their own home. So, many people with agoraphobia are afraid of leaving their home. So, their ability to carry out normal life activities is severely limited. So, when a person is developing agoraphobia, the person is having fear of being alone, fear of crowds, fear of leaving home, fear of public places, feeling detached from others, and as a result, there is anxiety also, of course. So, these are all comes under phobias, where we got three groups, that is specific phobia, social phobia, and agoraphobia. Next, we have obsessive compulsive and related disorders. Now, have you ever noticed someone washing their hands every time they touch something, or washing even things like coins, or stepping only within the patterns on the floor or road while walking? You might have seen people, touching certain things again and again, checking the lock again and again, cleaning again and again. Hmm? People affected by obsessive compulsive disorder are unable to control their preoccupation with specific ideas, or are unable to prevent themselves from repeatedly carrying out a particular act or series of acts that affect their ability to carry out normal activities. Okay, so here two things come into scene. One is obsessive and one is compulsive. Obsessive behavior is the inability to stop thinking about a particular idea or topic, and the person involved often finds these thoughts to be unpleasant and shameful. So obsession, it is the thought process, and compulsive behavior is the need to perform certain behaviors over and over again. So many compulsions deal with counting, ordering. They keep on counting, they keep on ordering, keeping things into order, then checking, touching, and washing. These are all compulsive behavior where the person need to, do certain act, behavior. They need to behave. So compulsion, it is involved with doing, and obsession, it is involved in the thinking, the thought process. So other disorders in this category include hoarding disorder, trichotillomania, that is hair pulling, some disorder like they keep on pulling their own hair, then excoriation, that is skin picking disorder. These are also some of the categories that fall under obsessive compulsive disorder. Okay, so this OCDZ, it has a cycle. What happens is that in obsessions basically are unwanted, distressing thoughts, urges, or mental images. It may include what if and doubts. Now, this obsession, it leads to anxiety. Anxiety, which may be distress, fear, worry, or disgust, and it's a false alarm. And where there is the feeling that they need to do something, and when this anxiety comes, then there is compulsion. That means when there is the need to do something, compulsion is any behavior performed to help make the anxiety go away, including checking. So when there is anxiety, the person feels that no, I need to do something to, uh, to away, to go away that particular anxiety. So in order to go away the anxiety, the people engages in doing certain things with the obsession. If there is obsession that I need to clean, this is the thought. Anxiety is I need to clean, I need to do it, and compulsion, the person does it in reality. And there is a relief that it is only temporary. Relief is temporary because obsessions come back sooner. And this is how the OCD people are always in the cycle, OCD cycle. Okay, there are also certain subtypes of OCD. like that of contamination obsessions with cleaning compulsions, then hoarding, symmetry obsessions with ordering compulsions. I said already that these are the other categories that falls under OCD. Okay. And the last topic for today's presentation is trauma and stressor related disorders. Very often, when some people have been caught in a natural disaster, floods, earthquakes, tsunami, war, terrorist attack, major accident, etc., they experience this disorder, which is known as post traumatic stress disorder. And in short, it is known as PTSD. In PTSD, there are certain symptoms that vary widely but may include recurrent dreams, that whatever has been happened it comes in the dreams again and again. There is flashbacks, impaired concentration and emotional numbing. Adjustment disorders and acute stress disorder are also included under this category. So with PTSD it becomes very difficult for the person to carry out his or her day-to-day activities, and even there is sleep disturbances. With PTSD the person is not being able to sleep also properly. After the First World War, okay, First World War, Second World War, the armies involved over there, they often had this post-traumatic stress disorder. They suffered PTSD. Because of PTSD, it gave a way to study the psychological effects, and that is how psychology came into being, and it has helped to understand why the people are behaving in such way. Okay, why there is difficulty sleeping, why their behavior is not normal, it is changing from the way they behaved before the wars. Okay, and afterwards there was a complete change in the behaviors. So PTSD, it just debilitates the people, it just affects their daily activities. Okay, so with this I have covered in today's presentation the classification of psychological disorders, and I have covered some major types of psychological disorders, starting with anxiety disorder, obsessive compulsive related disorders as well, and then lastly trauma and stressor related disorders. Please go through this and try to understand. Thank you.